It's the place you go if you're sick or injured, but it may end up costing your life. An estimated 98,000 patients die every year due to medical mistakes in hospitals. That makes preventable medical errors the 8th leading cause of death in the United States. Many say this is unacceptable.
Americans are not tolerant of mistakes. Why should they be in hospitals? So I think we've not done a really good job in approaching the problem the way you might in an industry such as the car industry. And I don't think we've approached it in a way that makes us want to be and capable of being error-free in everything that we do.
Mistakes can be made at any time during a hospital stay. Patients can be given the wrong medications. They can acquire life-threatening infections due to unclean conditions, or surgeons can even perform the wrong procedure on the operating table. To help ensure your safety during a hospital stay, the U.S. Department of Health and Human Services says speak up. Some important tips: ask anyone who comes in contact with you to wash their hands. Make sure you see them do it. Before surgery, you, your doctor, and your surgeon should discuss the procedure in detail together. You should all know exactly what will be done. Talk to your doctor about any prescriptions he writes. Make sure you can read his handwriting and check the label after you get the prescription filled. Lastly, choose a hospital that has handled many patients with your condition and one with a reputation for preventing mistakes. Some hospitals have made great strides in reducing medical errors. Cape Cod Healthcare is one of them. Comprised of Cape Cod and Falmouth hospitals, Cape Cod Healthcare has been recognized nationally for its commitment to patient safety.
The Board of Trustees at Cape Cod Healthcare has patient safety and quality as really job number one. If we do well there, we serve the community the best way possible.
From its renowned surgeons to its caring nursing staff, the team at Cape Cod Healthcare makes patient safety a priority. While there is still no national standard for preventing medical errors, the professionals at Cape Cod Healthcare have set their own stringent standards with their patients' health in mind. It's this proactive approach to patient safety that sets Cape Cod Healthcare ahead of the curve. The first step to patient safety is warding off infection.
People who get admitted to the hospital these days are much sicker than they had been in years past. And being sicker, they've had multiple surgeries, they've had multiple other underlying medical illnesses, and there's bacteria everywhere that we work and live. And being exposed to bacteria in debilitated condition like this would put people at risk for becoming actually infected.
Since enacting policies to protect patients from infection, Cape Cod Healthcare patients have had 0 cases of ventilator-associated pneumonia and 0 cases of central line-associated bloodstream infections. It's a remarkable accomplishment.
There are evidence-based practices that we know lower the rates of central line-associated bloodstream infections and ventilator-associated pneumonias. Are we elevating the head of the bed to a 30-degree angle so that we prevent that patient from aspirating and developing pneumonia? For central line-associated bloodstream infection, are we washing our hands before we insert the central line? We've been very successful with this program. Not only have we lowered our rates to less than the CDC, National Healthcare Safety Network rates for our ICUs, but we were able actually to come to 0.
Another important aspect of patient safety is preventing falls.
At Cape Cod Healthcare, we have a robust performance improvement project in which we encourage our employees to follow steps to help eradicate falls. Some of the things that we do on the front side is every patient upon admission is monitored for their likeliness to fall, and if they are considered high risk, we in fact put them on a high-risk fall protocol. So each and every patient is then transported with the idea that they're a high risk, and that goes throughout their entire stay.
When you think about a patient coming into the hospital, whether they're in pain, they've had an accident, post-surgical, they are automatically a risk for fall because of narcotics, post-anesthesia. Patients sometimes forget that they are unable to get out of the bed and walk to maybe the bathroom or go to the door. So what we have to do is try to prevent them from unsafely getting out of the bed, or remind them consistently that they are not safe to walk.
We definitely put a few different things into place that would prevent that fall, and those things begin with frequent observation of the patient. We do hourly rounds on this floor, 24 hours a day. During the night shift, we do them every 2 hours. It's done in order to be sure the patients are well hydrated, that we're taking good care of their skin and repositioning them frequently. And we've found that if we do that on an hourly basis for the 24-hour shift, that we have decreased our fall rate.
Cape Cod Healthcare also utilizes a surgical checklist to ensure patient safety. Before each procedure, the surgeon and his team review a standard list of criteria to make sure the right patient receives the correct surgery and that all necessary precautions have been taken. It's called the timeout.
When people come in for elective surgery, we want things to go right 100% of the time. Nationwide, there have been problems of wrong side surgery, surgery on the wrong body part, wrong patient identification. Patients don't want their surgeon to make mistakes. The best way we can prevent that is to take a team approach into the OR and have somebody not afraid to tell me, hey, Dr. Spillane, I'm a little bit concerned because you might have done this or you might have done that. And so we put that in one focus time immediately before we start the operation as a timeout. The goal is that 100% of people who come in for elective surgery come out.
Yet another way Cape Cod Healthcare works toward enhanced care is by building close relationships with the emergency medical service providers out in the field.
The treatment of heart attack patients is a tremendously dynamic and extraordinarily difficult process. We've learned over the last 10 years that we've been doing these life-saving procedures that it really requires the efforts of an enormous team of healthcare providers to obtain the best outcomes that we can for patients. These efforts start well before the patient ever reaches our door with the efforts of the emergency medical personnel in the field. We've worked over the last decade to educate these people in terms of how to recognize heart attacks, how to perform electrocardiograms in the field, and how to relay that information to us so that we can be all ready for a patient suffering for a heart attack often before the patient reaches the hospital.
Cape Cod Healthcare is the Cape's leading healthcare service provider, home to 400 physicians and 4,000 employees. Cape Cod Hospital has been chosen as one of the top 100 hospitals 5 times in the past 10 years. Located in Hyannis, the 38-acre waterfront campus includes one of the busiest emergency rooms in Massachusetts, along with many other major facilities. Falmouth Hospital was recently named one of the 50 best hospitals in America and serves some of the fastest-growing communities in the state. As more hospitals follow Cape Cod Healthcare's example and make patient safety a priority, medical mistakes will surely be reduced and lives will be saved.
I think as you get closer to what goes on at Cape Cod Healthcare, as I have over the last 8 or 9 years, you can begin to realize what high-quality professionals work here at both of these good community hospitals. And you feel reassured that should you ever need their services, you've got a first-line team able to deliver. So I've really been impressed with what I've seen here as I get closer to it.
In a perfect world, there's probably 400 things you really want to do well in a hospital. You want to prevent med errors, medication errors, prevent falls, prevent infections, and on and on and on. And we're trying to create the steps needed to get to those 400 great outcomes so that at the end of the day we can hand kind of an electronic pamphlet to a small community hospital that may not have our resources, and they can follow this how-to, and they can achieve safety as well, to the betterment of all.
For more information, visit capecodhealth.org.